sorry, future nurses, do not keep scrolling. This is one of the biggest NCLEX traps. It's BPH versus prostate cancer. I'm going to go over exactly what you need to know. No more, no less, no fluff. So make sure you save, share this out. Let's go. You have to watch this to the end, though. I'm going to tell you exactly what the NCLEX is going to ask. These two things were just recently on the NCLEX last week. BPH is a non-cancerous enlargement of the prostate gland. It happens due to aging, and what it does is it compresses the urethra. In return, it causes urinary obstruction. They are at high risk for UTI due to not being able to fully expel all of the urine out of the bladder. And what happens with urinary retention? They can have nocturia, so they have some urinary retention, or they might have some dribbling, a weak urine flow, urinary stream hesitancy. Prostate cancer is actually cancer of the prostate gland itself. The problem with this is it is a slow growing, or it can be fast. Mostly it's slow growing. It can metastasize into the bones and the lymph nodes. Signs and symptoms can be similar, so make sure you're writing this down. Know the difference. Now with your BPH, there's a difference. Major one is it can have signs and symptoms of hesitancy, but this has hematuria. They have cancer, most likely metastasize, and so they will have bone pain in the hips, the lower back, and their prostate is most likely going to feel hard versus smooth like BPH. That is a big difference. Hard prostate cancer, soft prostate with BPH. So the treatment for your BPH, you want to open out the urethra. So you're going to do your finasteride, you're going to do your tamulosin, have your TURP surgery, which is your transurethral dissection of the prostate. Biggest thing you need to know for the NCLEX about this is watch for bleeding with the TURP surgery. The NCLEX loves to ask that question. Monitor for TURP syndrome. They can become hypernatremia due to the irrigation fluid absorption. So how you're going to test for the prostate cancer, you are going to test with an abdominal exam, labs to see if they have elevated PSA levels, going to take a biopsy if needed. The biggest priority with prostate cancer patients is managing the pain. Bone pain is extremely bad and it's very hard to treat. You're most likely going to have to be on pain management. Memory trick, BPH, you can remember big but benign. That testicle smooth, but it's enlarged. With your cancer, remember crabby and crusty. Hard, it's irregular, it is painful, and it's spread to the bone. NCLEX gives you a patient that has prostate cancer. Monitor urine output, bleeding, and electrolyte balance. If you see back or bone pain, think of metastasized cancer in the bone. Is your priority treating the bone pain? Want more information like this? Grab my study notes at the top of my page. It's NCLEX Gold. It's helping everybody pass their NCLEX. I use them personally myself. I hope this helps. Happy studying.